Dr. Stephanie Reznick. I'm a board-certified internist and one of the medical directors for virtual primary care here at Oscar. In today's video, I'd like to talk about monoclonal antibody treatment for COVID-19. It used to be hard to get a hold of this treatment and very few people were eligible. But now the antibodies are more widely available and the FDA EUA has a relatively broad list of eligibility criteria, meaning many patients might be able to get this treatment. So who's eligible? Well, one thing to keep in mind, it does not matter if you've been vaccinated or not. Either way, you could still potentially have this treatment. If you test positive for COVID-19 and your symptoms started in the past 10 days, you may be eligible. There's a long list of conditions that would make you eligible, and you can look at the CDC or FDA website for details. That said, let me list some of the more common ones. If your BMI is 25 or above, your age is 65 or above, or you have a history of chronic lung disease or chronic heart disease, including high blood pressure, then you meet an eligibility criteria. Once you know that you've tested positive, symptom onset has not been more than 10 days ago, and you meet one of those inclusion criteria, you have to make sure that you don't meet what's called an exclusion criteria. This means you cannot be hospitalized, and if you're normally not on oxygen, your oxygen level must be 94% or higher. If you're normally on oxygen or have lower oxygen levels, then your oxygen level now must be within 3% of your baseline or normal oxygen level. So if you have COVID-19, it's been within 10 days and you don't need oxygen or to be hospitalized, and you meet one of those criteria, you really need to reach out to either your primary care provider or another clinician to discuss whether or not you should get monoclonal antibody treatment. Many primary care providers and even some specialists are able to prescribe it. The emergency rooms are often able to provide it as well, but keep in mind they're very busy with really sick patients, both COVID-related and not related. The treatment is given through an IV, or is called an infusion, and it can take some time, so make sure to bring a book with you or crossword puzzles, something else to help the time pass. Because the treatment has been shown to decrease the risk of hospitalization by up to 70%, I think it's an important option for patients to be aware of. If you have any questions and you're an Oscar member, the virtual urgent care team is available to you 24/7 on your app. If you're eligible for virtual primary care and you're looking for a new primary care provider, please schedule an appointment through your app or through your Oscar website account. We look forward to being your partner in health. Thank you for listening, and I'll see you next time.